Diabetes mellitus is defined as a heterogeneous metabolic disorder characterized by common feature of chronic hyperglycemia with disturbance of carbohydrate, fat, and protein metabolism. Types of diabetes mellitus. Type 1 diabetes mellitus. It is insulin dependent and is caused by lack of insulin secretion. Type 2 diabetes mellitus. It is non-insulin dependent and is initially caused by decreased sensitivity of target tissue to the metabolic effect of insulin. This reduced sensitivity of insulin is often called as the insulin resistance. In both types of diabetes mellitus, metabolism of all the foodstuff is altered. Other causes of diabetes mellitus includes specific genetic defects in insulin secretion or axon, exocrine disease of the pancreas that lead to destruction of beta cells, severe endocrinopathies that can lead to diabetes mellitus. Gestational diabetes. It is a condition in which your blood sugar level becomes high during pregnancy. It affects up to 10% of women who are pregnant in the US each year. Gestational diabetes goes away after you give birth, but it can affect your baby's health and it raises your risk of getting type 2 diabetes. The prevalence of diabetes mellitus has increased dramatically in the old due to increasing urbanization and consequent lifestyle changes. Some of the clinical characteristics of patients with type 1 and type 2 diabetes mellitus. The age of onset of type 1 diabetes mellitus is usually more than 20 years. However, for type 2 it is usually more than 30 years. Body mass is low wasted to normal in type 1. However, there occurs visceral obesity in type 2. Plasma insulin is low or absent in type 1. However, it is found to be normal to high initially in type 2. Plasma glucose is increased in both type 1 and type 2. However, insulin sensitivity is normal in type 1 but it is found to be reduced in type 2 diabetes mellitus. Diagnosis of diabetes mellitus. Various chemical tests of the urine and blood are conducted to perform its diagnosis. Urinary glucose. In general, a normal person loses undetectable amount of glucose, whereas a person with diabetes loses glucose in small to large amounts in proportion to the sensitivity of the disease and the intake of carbohydrate. Fasting blood glucose and insulin levels. Fasting blood glucose level in the early morning is normally 80 to 90 mg per 100 ml and 110 mg per 100 ml is considered to be the upper limit of normal. A fasting blood glucose level above this value often indicates diabetes mellitus. Glucose tolerance test. Glucose tolerance curve. When a normal fasting person ingests 1 gram of glucose per kilogram of body weight, the blood glucose level rises from about 90 mg per 100 ml to 120 to 140 mg per 100 ml and falls back to below normal in about just 2 hours. In person with diabetes, it is always above 110 mg per 100 ml and often is above 140 mg per 100 ml. Both genetic and environmental factors are involved in development of the diabetes mellitus. Incidence of diabetes mellitus is similar in men and women throughout most age ranges but is slightly greater in men above 60 years of age. Clinical manifestation. Symptoms are due to hyperglycemia. Complications of diabetes. A. Acute complications. Hypoglycemia. It is common in type 1 patients. It may be caused by missing meals or doing unexpected exercise after taking insulin doses. Symptoms can be sweating, nervousness, tremor, hunger. If it is not corrected in time, central nervous system symptoms ensure like confusion, abnormal loss of consciousness, or even convulsion. Diabetic ketoacidosis, mostly a complication of type 1 diabetes mellitus. B. Late complications. Diabetic macrovascular diseases, atherosclerosis, leads to vascular insufficiency and an ultimate production of ischemia in the organ supplied by injured vessels. Other example includes myocardial infarction, brain infarction, gangrene of toes and foot. Diabetic microvascular disease. Increased thickening of the basement membrane in small vessel leads to diabetic retinopathy. Diabetic mellitus is the leading cause of blindness in the developed old at ages of more than 20 years. Diabetic nephropathy. Diabetic mellitus is leading cause of end-stage renal disease in the developed old. Diabetic neuropathy. It occurs in approximately 50% of individuals With diabetes mellitus, it manifests as polyneuropathy, mononeuropathy, and or autonomic neuropathy. Exercise prescription. The benefits of regular exercise in individuals with type 2 diabetes mellitus are pre-diabetics include improved glucose tolerance, increased insulin sensitivity. Exercise benefits includes reduces insulin requirement, improvement in cardiovascular disease risk factors, lipid profile, BP, weight, functional capacity. It also promotes the well-being as well as prevent or delay the transition to type 2 diabetes mellitus for individuals with pre-diabetes. FITT recommendations for individuals with diabetes mellitus: frequency 3 to 7 days per week, intensity 40% to more than 60% VO2R corresponding. Better blood glucose content may be achieved at higher exercise intensities more than or equal to 60% VO2R. Time: type 2 diabetes mellitus 150 minutes per week. Bouts of at least 10 minutes and be spread throughout the week. Additional benefits are acquired by increasing to more than or equals to 300 minutes per week of moderate to vigorous intensity. Type: activities that use large muscle groups in a rhythmic and continuous fashion. Progression: resistance training plus aerobic training.